Good day, my dear students. I'm sure that you're all preparing for the examination. And I thought I will just have a chat with you before the exam. So we are in the last lap. Lap means it's a round. Okay. You are in the last round before the exam. And let us see what is in store for us and how we can handle it. This is a concept that I had taken for the short talk of mine. And this gentleman is told, and he is from Ethiopia. Something that is very strange that I'm seeing in him. The focus, the grit, the determination, the synchrony, the effort. I'm sure all of this will be there within you before your marathon, that is the exam. And as such, you have been running the marathon and we are in the last lap. And I also picked up a very nice saying. If the marathon is only of part-time interest to you people, the results also will be part-time. So let us make it full-time and let the results be full-fledged for us. Now, whenever a question is there, I always used to tell you people, bother you, think of the subheadings. The subheadings will take you to the answer. But then, when you have got so many subjects, it is not just pathology, you have got microbiology, pharmacology, and each one of them have got their own subsets. What exactly in path are we supposed to concentrate on? I have put certain things in an enlarged block format and the others in the ordinary format. Gross microscopy, because these will be eye-catching, reproducible, and not that etiopathogenesis, that is the cause and the mechanism, will be important in certain diseases. Now it will be your duty to find out what such questions are and concentrate and mark them in your book. Discuss with your friends. Do whatever you want. The other things, of course, are important and they might be asked as independent questions. Complications. For example, the sickle cell crisis. Even otherwise, these subheadings will be forming part of an essay question. Therefore, it will be better that we know each answer part by part rather than answering a wholesome answer which will not take us anywhere. And your sources shall be the text. The text that you possess, you read. Do not change it at this moment. R.A.T.S. I have been reflecting all the text in my classes and I am very sure that it will be of use to you people. Not that you will have to go back to R.A.T.S for all the classes at this moment. Anything that is of a little difficulty, you people can go back to it and then go back to your text. This will be the best modus operandi. Your record that you have been possessing, getting the signatures, drawing, etc. Now it has been drilled into your mind. So the record of yours, it has got a plethora of facts that will help you. Not only the identification, but also lots of other things such as the causes of hematuria, the causes of proteinuria, what are all the reducing substances, what are the physical changes in the urine, what are the methods of hemoglobin estimation. so on and so forth. And these have been very well supplemented in the R.A.T.S also. Last but not the least, your notes. The notes that you have taken down in the class or you have prepared by yourself will be the ultimate armamentarium in your weapon. Don't try to rush progress. Even at this time, I know that we are only about a month or a little more before the university exam, but still do not rush. Remember that if you take a step forward, no matter how small it is, it will definitely be in the right direction and take us forward. So, this is a wonderful saying. I would like you people to kindly have this written and preserved in some part of your hostel. There are some do's and don'ts. Must. As I mentioned earlier, notes. Even now, you cannot take elaborate notes, but scribble the important salient points. What are the stages? What are the cells? What are the subheadings for the differences? What are the thrombotic, antithrombotic? Only the words. You cannot write sentences now. Draw. For every answer, there must and shall be a diagram. A diagram that is simple, reproducible at any time. It need not be a histological microscopic diagram. Listen, even now. That is the idea of reading aloud. When you read aloud, you are listening. So you are having two sources of information. Your eyes as well as your ears. They feed your brain. Read, of course. Read or study, whatever it is. Any number of times. The second time, third time, fourth time, you find that speed comes to you automatically. And there will be a time when within about 10 minutes, you will be able to revise the entire chapter. Time management, there are two things about time management. One is how you are going to manage the time before the exam. Now, as I told you, you have got three main subjects and they have got subdivisions. Nothing should be spared. So, how you are going to divide the time and organize yourself? That is very important. Of course, it is not new to you people. You will be putting the timetable and will be revising the timetables repeatedly instead of revising the text. And there is also a list of must not. This is more important than this list. Do not try to outsmart the examiner. Many of us have got this tendency. We try to answer something and get out of it. Please do not do it. You must be able to show your answer in any of a text or reference. Do not omit. Do not omit anything. There is nothing like an important question and an unimportant question. As I told you, the question that you omit is your university question. And all university questions must be reflected in your reading. Do not overdo again. Do not try to be very accurate, not at the cost of time, the other subjects. At the same time, do not worry. Exactly this will be the phenomenon. You read again, there will be a total sense of blankness prevailing upon us, as though nothing is remembered. You are in a state of dementia or Alzheimer's, but do not worry. The answers will come to you provided you have read them sincerely. And do not compare yourself with others. It should have been done at the beginning of the year, not now. And do not be selective. Omitting and selective are almost the same. Don't be selective in your questions. Don't be selective in your mode of answers. And do not pretend that you. Is it clear? So these are extremely important. As I told you, there will be some units of a question which you should answer. Gross means gross. Bone marrow means bone marrow. Blood picture means blood picture. Classification means classification. So there is nothing that can supplement these questions. So this is again a beautiful one. The runners are supposed to divide their race into thirds. The first race will be part of it in the head. The middle of the race will be your personality. And the last lap that you people are now will be in your heart. So take the exam to the heart and do the best. Forget the result part of it. Definitely, you people will be able to see the reflection. The marathon is an event where everyone is equal and ordinary at the starting time. But you find that a legend is born at the finishing line, or the finishing line. So beautiful quote. So all of us appear more or less. This you people do not know, but we as teachers and examiners know. We see the differences between papers. So what I can do now is I can improve upon myself. For me, the control is only me. How much I can improve upon myself, not X or Y. I'm not bothered about him or her. So this will be of great importance. Amazing again. Choose the right track. Whatever is good for you, you people choose. Good in the sense, the mode of reading, the writing, or the source of reference, etc. Choose that and again see the focus. Keep going on. Do not look backwards. Once you have chosen the right track, put in your efforts, never ever look back again. And you are continuing with your last lap. Now, the usual confrontation seen in the student is what are the important questions? Naturally, it is an anxiety and that they are not able to seemingly recollect everything. So they say this. But in my experience, it is this. Your theory is equal to practical, is equal to viva, is equal to MCQ. There is no segregation between these compartments. And if you read one at any one unit, it will definitely get reflected in your performance elsewhere. So concentrate on all alike. Theory is a question. The chart is a question. The slide is a question. The specimen is a question. Viva voce is a question. And MCQ by themselves are a bundle of questions. So please do not segregate and do not choose the important questions. So the dictum is the question that you omit is your university question. So 80% of the exam is always based on the one lecture or the one question that I have missed or I did not. What are you seeing in this picture? What are the things that you people observe? Amazing. It is not just the race of it. Again, is Kipchoge from Kenya. These countries have been subject to immense poverty. Tanzania, Kenya, Jamaica, etc. And they have produced wonderful athletes and marathon sprinters. What am I seeing in it? There is an aim, there is a determination, there is a consistency, there is a rhythm, there is a focus, uniformity, and in the last lap, he is not giving up. The speed, the distance, and see, he is never looking back and seeing who is coming after him, etc. Nothing affects him. The goal is his focus. A wonderful theme that can be reflected in our exams. This is a quote from Robbins himself. No? Sometimes it is better to know something about everything rather than everything about something. Some students are extraordinary in some answers. They omit a few questions, one or two. Whereas some others are just mediocre and average in all the answers. So you can guess who does it better. So it is better to know something about everything. It is not possible, it is impossible for even Robbins to know everything about what he has written. Now I am coming to a question paper. The question paper, there are various things. It can be my own university, it can be an Indian medical university, or it can be a Karnataka university or some other private university. Whatever be it, I always find there is a general pathology and hematology. And the next one shall be systemic pathology. Now, what is important is, see, in a chapter on neoplasia, they have asked about 3 or 4 questions. So they are dividing it. So in such a case, what happens is, even if I write this one excellently and omit something, I'll be losing these marks. Therefore, it is important that I know every unit of it almost uniformly. Need not be extraordinary, but I should get that average mark throughout. If it is extraordinary, good. So that is a neoplasia. Nowhere else is neoplasia being reflected, which means they are not mentioning the tumor markers. They are not mentioning the precancerous lesions. They are not mentioning the other paraneoplastic syndromes or the laboratory diagnosis. What I'm meaning to say is, if those are asked, there is no space for these questions. So always you should know that there is a lot in a chapter that cannot be reflected in a question paper. Leave alone that. Now, regarding the infections, there is only one component, the granulomatous inflammation. They have not asked leprosy, they have not asked typhoid, so on. Fat embolism alone is asked. Thrombosis I have studied thoroughly. So we should read each unit of it. I would like you to be a very, very critical person. As soon as you read that particular unit, just mark it, turn the page, go to the next one. Do not turn back. Remember the previous picture. This again is our friend, a problem-based question. I'm not going to explain the problem-based ones. It will be easy for you people. Do not panic, common sense. If it is going to be a patient with jaundice, mostly it can be obstructive or hemolytic. And in hemolytic, it has to be something related to hematology over here. So what are the things they mention? And there will be certain other findings, like what is over here, hair on it. Similarly, in any of the questions, there will be some clue. Catch hold of the clue, or in fact, it will be better that you can write that particular terminology in a separate paper. All the terminologies, hair on and appearance, fine. Then punched out appearance, fine. Massive splenomegaly, fine. So these are things. Spoon-shaped nails. So there are many such things which I would like you people to kindly note it. But please do remember, this will not become the answer, but it can lead us to the answer. And they are asking about the pathophysiology, and then they are asking about the hematological and other laboratory diagnosis. Laboratory diagnosis means it will be a blood picture, it can be bone marrow picture, it can be other investigations. So the entire list alone I should know. Subheading, subheading, subheadings. And there are a lot of these other questions. See this. In spite of all this, there are lots of questions which have not been asked in this. It is not possible. One essay and just 4 or 5 short notes. I will not be able to cover the entire syllabus. Sometimes there can be a repetition and we will be in trouble. So do not omit anything. So this is the warning. All chapters are not covered in the question paper. The distribution is not constant. We used to call it weightage according to the marks. Some questions are not straightforward. Problem-based questions can be given. Time management. Earlier also I mentioned time management. Now also I mentioned. In this time management means the total amount of marks must be divided by the time available. So that, or rather the other way around, the time available should be divided by the marks. So that for each mark I should be having this. I think about 1.8 minutes or so will be allotted for a mark. And there is nothing like important or unimportant questions. If you read peptic ulcer, you will get gastric carcinoma. If you read ulcers of the intestine, you will get polyps. If you read cirrhosis, hepatitis can be a question. If you read osteosarcoma, osteoclastoma can be a question. So there is nothing as important or unimportant. A question that has been asked even once in any university exam may be the question for you. So all the questions try to. And for that, listen, go back to the book. That is the maximum that we can do now. And now I would like you people to take a long step. All that you know, turn the pages. Your mind already knows it, so do not bother about it. See how he is picking up the speed now towards it. You see the difference between the first picture and this. Thanks to Alan. When you run a marathon, you are running against the distance. You are not running against other runners and not against time. So, in your case, you find that it is the exam that matters, not your colleagues or the time that is available. Just be deliberate and slow. Speed will come to you automatically. So, exam questions in which IQ is equal to UQ. IQ means your intelligence is equal to UQ, university questions. Why am I saying like this? If you finish all the university questions, 10-year questions in continuity, and still have a lot of time, you can read the rest. This is usually a priority. Supposing there is one rare question that is asked out of these, then probably some sympathy will be there for the students. Even otherwise, one student who answers that might get an additional mark. We are not bothered about it. So we are going to cover the university questions and again repeat it. Diagrams, subheadings. So finally you find that Tola is reaching the goal. So this is yet another question paper in which you will be able to see that there can be a problem-based question over here. So what is the diagnosis and what? So you people should be familiar with the problem-based questions. And there can be the short notes that are there. There are two sections over here that are there. One question is straightforward and a set of short notes. Another set of short notes. This is in systemic pathology. Some questions may be weird, doesn't matter. As long as I know something about that, I'll be able to get some mark. Look at this. Nobody expects a malignant melanoma as a question. Does a retinoblastoma can be a question. So this again is a history. Common histories. You have got plenty of time in the world. If you people do not know, don't waste time searching for. Ask your teachers, ask your seniors, ask your postgraduates. You will get the answers. It depends on you only. So this is a relief rally. You can see the happiness on his face and the triumph in his body. He has done it. I'm sure that you also will be able to do it. The pride in finishing a marathon is much greater than the pain endured during the marathon. All along, you people have been undergoing a marathon, and now you are going to finish it. I wish you all success at your exams.